So thank you again for joining me today. We're going to learn the differences between Medicare and Medicaid. Some of you might be new brokers, some of you might be seasoned brokers. I hope to simplify these programs so that you can navigate through this market, and in specific with a special need plan demographic. Hello, my name is Yvonne Blanco. I am a broker sales manager here at Insurance Advisors Direct, and I'm also the special needs product consultant. If you have any questions during the presentation, like some of you did, please click on the chat or the Q&A button, and I will answer these in between slides. Maybe at the end of the presentation, we can have a kind of an open forum. I really want us to take the time to understand these programs, these terms, and of course you can email me and we can take more in-depth look or discussion on these. So let's go over the terms that you may see on Medicare.gov, along with a brief overview on terms that we most commonly hear. I did create these slides to be used as a reference sheets, and I will be sending these along with the charts that I refer to in the presentation to all the attendees as a thank you for your time and support on getting to know these programs to help your community. So I do have a couple of chats. Oh yes, that you can see. And I will email the slides, yes, so I addressed that. And thank you again, all of you, for taking the time to join me today. And hopefully we can get all of your questions answered. And again, like I said, after the presentation. So with that, let's go ahead and get started. So of course, Medicare is a federally funded government insurance program in the US. You get, and a lot of people, of course, when you're turning 65 or you're over 65, this is where most people know what Medicare is most commonly. Of course, we know as brokers that if you're under 65 with a disability, if you have end-stage renal disease, and people receiving Social Security disability insurance, otherwise SSDI, of course, with these individuals that are under 65 and on SSDI over a certain amount of time, so on that 25th month, they are then eligible for that Medicare. Brief little fact, Medicare began in 1965 under the Social Security Administration and is now administered by CMS, who regulates a lot of our sales techniques, as you know. All right. So of course, Medicare benefits are across all 50 states, and they're pretty much the same on all 50 states. You know, your income is not an eligibility factor, but it can determine your premium and your deductible for some of the Medicare parts. So of course, we know what Medicare A, B, C, and D, what those refer to. And so I went ahead and put this on the slide just as a brief kind of review, and maybe just a brief look at while you're on the road. What was that for? What is C entitled people for? Now with Medicaid, Medicaid is both funded by the on the federal level and also on the state level. Your marital status and income is an eligibility factor. You are eligible for Medicaid at any age. So the benefits and the criteria and even the names of Medicaid. So in Arizona, it's referred to as Access. In California, it's referred to as Medi-Cal. Here it's referred to, in Michigan, it's referred to as Medicaid. Most commonly, it's known as Medicaid. But they do vary from state to state, as the credentials and to be able to qualify for those do vary also from state to state. Individuals on Medicaid, now keep that in mind, may also qualify for SSI, just so you're aware of that. So now Medicaid, you must meet a low income or federal poverty levels, otherwise known as FPL, to become eligible in your state for these benefits. We call them duals, right? So if you meet the criteria for both Medicare and Medicaid, then you are considered a dual eligible. Those that become dual eligible can qualify for a Medicare savings program. This is where it gets a little tricky. I'm sure you've seen this on Medicare.gov. A lot of the brokers, when you're first starting out, where do you go to see what's available? What is the plans? Some agents use a quoting engine, some go straight to Medicare.gov, and then that's where you'll see choices of Medicare.gov or I'm sorry, Medicare Savings Program, LIS, Extra Help. You'll see these terms, and we're going to go through those in these slides. So of course, the Medicare Savings Program, a lot like the Medicaid, in order to be eligible for it, you have to have A and B. You can't have just Part A. And of course, your income and resources must meet federal and state limits, which are usually done by your income levels. So what does a Medicare Savings Program provide? So this is something that I have on a couple of the charts, but this program can help pay for Medicare costs, but it's not limited to these. So obviously it'll pay for your deductibles, your co-pays, your co-insurance, and that Part B premium. Yes, that is really important for seniors now. It's a little higher, and we do understand that their Social Security has gone up in pay, but also the Part B premium has gone up. So really, are they still getting the same amount? I don't know, but we do notice that those of us that are in this field. So those that qualify for the Medicare Savings Program are also eligible for extra help. Okay, so now we're going another level, right? We're Medicaid, Medicare Savings Program, and now here's another term, Yvonne, extra help. Don't worry, we're going to be going through these terms a little bit more. So, okay, most of us know extra help as LIS, right? Yes, and in Minnesota, it's medical assistance. Thank you so much for that, Mark. So, Minnesota is in the house, right? All right, so extra help, LIS, limited income subsidy. So extra help provides assistance in paying your prescription drug costs under your Part D, and it can also lower your premium to zero for some of the Medicare Advantage plans, right? We've seen that where it's attached to that Part D, that premium, and then when you get extra help, now that premium is zero. If you're wanting to know which health plans are in your local area, please reach out and I can explain that a little bit deeper. Extra help also pays for any Part D penalty due to late enrollment. So that if somebody has a very high Part D penalty and they're running into, maybe they don't qualify for full Medicaid, and we'll go into those levels, and they make a little bit more and they qualify for the extra help, and now they're receiving 100% of what's extra help is available to them, that can help with that Part D penalty, as well as some other benefits along with that. I made a nice little chart for you guys to be able to refer to. So this is one of the charts that I have. These are the types of Medicaid programs. Now, in most of your carriers will refer to the top four, right? And you usually see the FBDE, QMB, QMB Plus, and the Q1 and QDWI. You might see those on some of the plans, but really when you're working with a carrier, the first four, plus the FBDE are the most common that we run into. But I figured I'd put all of these down so that way it helps navigate for you, because a lot of our public doesn't know what they have. They just say, I'm on Medicaid. Then you call your carrier that you're working with, whether it's United Healthcare, Aetna, Molina, or someone or a carrier that's specific to your state that is actually helping the special needs population. They will tell you what level they're on. And so this chart will kind of tell you exactly, is it helping their Part A premium? Is it helping their Part B premium, right? What is that cost share? Do they have that help, that assistance as well? If you need to know a little bit more about those columns and more explanation, please, let me know or send me an email. So hopefully you have no questions at this point, but it's kind of going through these different terminologies, right? So QMB, right, with QMB, some of us say, qualified Medicare beneficiary. It will have the Part B premium covered. If not eligible for premium-free Part A, QMBs are covered in that as well. They cover that Part A premium. Medicare is your primary coverage, and then Medicaid is your secondary. QMB is the highest level of the Medicare Savings Program. This is where it gets a little tricky. You're like, Yvonne, I thought we were talking about Medicaid. Why are you now bringing up Medicare Savings Program? In Medicare.gov and also in any of your Medicaid offices, they refer to it as a Medicaid Savings Program, but it's still pretty much kind of under that umbrella, that Medicaid umbrella. So these individuals do not exceed the 100% federal poverty level. I'm really big on job aids, on cheat sheets, whatever you want to call them, that one form that you look at, and it's going to give you the different FPL levels or income levels for your beneficiaries or your possible members. So you're not their caseworker. I know I've said this before, I just want to repeat it. Brokers are not their Medicaid caseworkers, right? But we are navigators to be able to navigate them to the proper programs or facilities that they need to communicate with. With that being said, we need to know these terms. And so hopefully this will help you out. And also, when you're going through this, if you have questions, please let me know. So again, for those of us that do Medicaid and we run into someone that will fall into that LIS or extra help, or that do Medigap policies, just keep in mind, clients don't need a Medigap policy, since when you're a QMB, qualified member beneficiary, Medicare beneficiary, it will cover your premiums, your co-pays, and your deductibles, okay? A simplified low-income Medicare beneficiary, otherwise known as SLIM-B, right, will pay for your Medicare Part B premium, but you must qualify yearly. So sometimes you might run into people where it's like, no, I don't want to apply because you have to do that once a year. Usually it's just to make sure that nothing has happened that's different in your income level, you haven't moved or anything of that nature. I do have a question of when is there a premium? Oh, yes, I'm sorry. How are you able to buy dual SNP leads? Okay, so for that demographic specifically, there are tons of vendors, lead vendors that we work with. And when you order, you want to order, there's certain criterias in order to make that lead order. It'll be your zip codes that you want to target, certain areas. The yearly income is where you're going to kind of toggle where you want to find the individuals that are in the federal poverty levels, right? So anyone that's 17, we'll say 17,000 a year and below would fall into that. And maybe into that not so sweet spot extra help, because sometimes, you don't really qualify for full Medicaid, but you can't pay for a med sup. So a lot of these Medicare Advantage plans that are zero copays, zero deductibles, zero premiums, they're great with that. When you have a premium for Part A is another question. And of course, if anyone else wants to add to that, please send me a chat. There's so much information in this that sometimes we forget all the nuances. But with a Part A premium, you usually have to pay for that if you have not worked 10 quarters in order to qualify for that free premium Part A in our Medicare. Hopefully that gives you just a kind of brief explanation on when you get that premium for Part A. So a QI will also pay for Part B premium. That's a qualified individual. You must qualify yearly, just like the SLIMBs. And this program, though, a little bit different, is first come, first serve basis within your state. So not everyone's, even though that they might have that qualifications for their income, they might not get this because it's only supplied for, they cap out And, during the pandemic, there was only so much to kind of go around. And so due diligence, if you're helping someone and they're really on top of paperwork, then these programs can help them as well. Qualified disabled working individuals. This program will pay for your Part A premium. If you're under 65 disabled and working, you may qualify. This is what is important on this for this program. If you're under 65 and you're still working and disabled to qualify, the key about this program is you have to be still working. It is not, that's why you see it in the title, qualified disabled and working. So it's not someone that is on disability that is not able to work. Each state may have different names for this program as well, or different types of savings programs. Oh, 40 quarters, that's right, for 10 years. You're absolutely right. Yeah, I got my terms. You're absolutely right. It's for 10 years for 40 quarters. Yeah, it's a good thing I'm not a math teacher, but thank you, Brian. You're absolutely right. That is correct. To clarify for Mark, hopefully that answers for that part, or Tom, for that Part A premium. Hopefully that answers that question. And also for the DSNP leads on how you can acquire those. So you're absolutely right. Thank you so much for that. Now, this is a new term that came about 3 years ago, this FBDE, full benefit dual eligible. And this is where we get a little confused. When you're on the Humana site, you'll see somebody's a full dual. And so a lot of us think that means it's a QMB. Full dual, the full benefit dual eligible in that chart will kind of break down that we referred to previously. It'll break down what they qualify for. So they get like their full Medicaid benefits, yes. Do they have that Part A premium paid for? No. Do they get that Part B premium paid for? No, they don't have that either. And it is conditional on the Medicare cost share. So they may meet the income and resource standards for Medicaid, but does not mean that they meet those criteria for QMB or QMB plus. So what's important for us as brokers is when you are looking at your dual special need plans, an I-SNP plan, or even a C-SNP, they'll give you levels that they will consider for that D-SNP plan. Most of them are QMB, QMB plus, right? Slim B, Slim B plus, and some of them will say FBDE. So that's where you want to see that these levels that they're accepting to be on that dual product. I hope I made sense of that for you guys. So again, remember that each state might not have this FBDE, and then the others, they do. Are there two different levels for QI, or does that vary by state? Yes, so some of these Medicare saving programs, they do vary by state for those different levels. The names, whether it's QI, QWI, FBDE, they seem to be kind of used commonly throughout the states, but those levels, obviously the income levels will vary for sure. For sure, they will vary by the states you're in. So hopefully I'm making this clear for you guys. Now we're going into applying. What is it that, again, we're not their caseworkers, but it's good for us to know what is our member going to expect. So individuals can apply throughout or any time of the year, either at your local Medicaid office, or if you're over 65, you can also apply on Medicare.gov. I do have a YouTube video on there that I did a while ago on LIS and how you apply for extra help. And that will also guide you on when you're applying for that LIS. You can have that information given to your state, and that's the first, drop of the domino, so to speak, that'll start that process of your Medicaid application. So they're not having to go over to the office or wait 2 weeks, 2 months for an appointment. People who are on these programs qualify for a special election period, the SEPs, when you're doing your application, and they can change plans or enroll throughout the year. So if you are on Medicaid, any of these levels, QMB, QMB plus, if you are on extra help, if you are on a Medicare savings program, some people, extra help LIS, you are able to switch plans throughout the year, and it's only per quarter. Okay, and you can't do it the last quarter, which is AEP. If you want a little bit more information on that, please go ahead and email me, and I'll give you my, again, job aid cheat sheet. I'm really good at those on how the quarters work. So again, we'll get this step by step. I do have a step-by-step guide that's going to go to everybody with screenshots and arrows on how you apply for that extra help, that hopefully you can share with your members if they have questions. Yvonne, how does your member, if they ask you, hi Bob, how do I apply for extra help? Hopefully this step-by-step guide I give you, you can give to them, and it'll guide them on that application. So what is needed to be at hand if you are going to assist a beneficiary? You don't have to, but in case you do, these are some of the things that they're going to have on hand for that application. Let's see, we got a couple of questions. Let's see what's going on. There are income levels for all that will qualify, and another level that first come, first serve in North Carolina. Okay, thank you. This is for LIS. No, right, yeah. No, it is easy to get confused in regards to Medicaid, Medicare Savings Program, LIS, extra help, right? This is why we're kind of going through all these terms. I got another question. Do they get other benefits other than premium helps under these programs? Of course, yes. So when you are on a Medicaid program, any of these programs, it will go ahead and assist you with costs for your dental, for your vision, for your exams, for transportation. It's really trying to focus on the health needs of that demographic, especially if they don't have a vehicle. A lot of transportation is a big one, especially if you're in a wheelchair, you need to have this help. Do you have to see certain doctors? Yes. When you're on a Medicaid program, a dual SNP program, those are Medicare and Medicaid doctors. Usually you can find those within your carrier sites. Some of the carriers might not want to be on their site, or I'm sorry, some of the providers might not want to be on their site. So I really recommend sending emails to your carrier broker support desk, finding out if that doctor is in that network. I do know that some of the Medicaid doctors throughout the different states that I work in for these special need products, some of the doctors don't want to be on their provider site, for whatever reason. Maybe they don't want to be flooded with patients. Maybe the uploading, as they say, once they print that network directory, it's already out of date, right? So we go on the computer, and maybe, just using a computer doesn't mean everything is done properly or on time. So sending that email to your broker help support desk for each of those carriers, I think, is important. Let's see. I'm just reading some of these chats, so be patient with me. Not sure the difference in people who actually get help with premium helps and benefits help. Not sure I understand that question. I'm not sure the difference in people who actually get help with premium or just benefits. Okay, so sometimes individuals would just do an application through Medicaid, your Medicaid state office, and they're not getting that Part B premium paid for. That's where I suggest, because again, you got to call the caseworker. Maybe they'll call you 2 weeks, 2 months, maybe not. You can go ahead and contact that. But if they're ill, they're elderly, the easiest way to have someone review it is to go through Medicare.gov, do that LIS application, and go through that. Okay. Let me see. I think I've got them all for now. I hope. I think that's good. Sorry, I want to address those real quick. So of course, what is it that they're going to have on hand? So let's get back to that application. So they're going to have this information, obviously their legal name, which, you know, is an ID card. You have that. Proof of residency, a bill, an address. Sometimes individuals, you know, transpose numbers. It's good to have something on that on hand. Proof of age, that would be on an ID card. If they don't have that, you know, you definitely don't want them to take out their birth certificate or anything like that. But you understand what that means on how you can get this information. You don't need to know their checking and savings, banking accounts. They don't have to show you their banking information. Just a roundabout, you know, offhand, how much do they usually have on those accounts? When you're doing the LIS application, it will ask you for that. You want to see that Medicare card and other proof of insurance. If they already have insurance, it's important to ask them, do you have a card? A lot of people, and I don't know if you run across this, they take out that their RX card that they get in the mail from any company, and they say, see, I have insurance, and it's actually a prescription drug card, right? So it's important to look at that as we educate our community and especially our seniors so they can make that informed decision, and we're empowering them at the same time, right? Working on that referral, right? As well as helping the person right in front of you. If they have retirement accounts, stocks, bonds, mutuals, funds, stuff of that nature, you want to know so that way when you're doing that application, it's on hand. So what resources are allowed? Now, I did have one of the brokers that I chat with on a pretty regular basis, and we were talking about, okay, Yvonne, if they are going to be applying, what are they allowed to have? So I included this brief little last minute slide for those of us. I thought it was a great question. Some people think that you can't have a home. You can't have anything. You have to be somewhere on the street living in a cardboard box or destitute. Not true. So these are some of the things that you are able to own, you are able to have. There's another you know, list of items, and let me just see. I think I actually no, I didn't include it on one of these handouts, but you can have like jewelry, you know, if it's like heirlooms, things that have been, you know, that maybe are just, you know, passed from generation to generation. You can definitely have those. Okay, hopefully that answers that question. So again, the 7 levels that we were talking about, these are the 7 levels of members' cost share. I know this seems a little bit tricky, maybe confusing. I won't go too much in depth with it, but it is one of my cheat sheets that I love to refer to, or job aids. That's probably a better way of saying it. I really am a fan of these, especially when you're driving in your car, which I know most of you from appointment to appointment, who wants to keep looking at different summary of benefits or books, and if you can just look at it on one page to just kind of refresh your memory. So if there's any questions on these, you know, please let me know. But that's a nice little cheat sheet for you guys. So in review, we went ahead and we did the differences between Medicare and Medicaid. We found out a little bit about what that Medicare Savings Program is, right? The Extra Help LIS. These are terms that when you are on Medicare.gov, if you are a new agent or if you are a seasoned agent, I'm sure that they would probably recommend as well. For those of us that are looking at plans or just wanting to talk to our possible beneficiary about those, Medicare.gov is a great site to gear them on, to educate them on, and to see these different programs. And you'll run into these terms. So when somebody says, Yvonne, you know, I'm on Medicaid, or I'm on Medicare Savings Program, or I'm on Extra Help, I hope that I clarify these for you so that way you know a little bit more about what these terms. Now, I do know that with more knowledge, we do have more questions. So if I did create more questions for you than answers, please go ahead and take down my information send me an email. I do these, we're going to be doing a series of these webinars in regards to Medicaid, extra help, how you do sales in this demographic, what are the information, the different other charts that I like to have handy, the federal poverty level chart, areas, maps. There's a lot of little, nice informations. So yeah, so if you have more questions, then please, send me any of the chats. I'm always open to learn from you, as well as bringing things up that we can have a discussion about. Again, thank you so much for joining me. I'll be looking for your emails, and we'll be sending you these nice job aids, and hopefully you guys will join me again. Thank you very much.